Hi, I'm your host Lisa Hart, and we're at the 2016 Mission Hospital Gala here at the Monarch Beach Resort. And I have Patrick Kennedy here with me. Well, thank you for being here. Appreciate it.
My pleasure. It's great to support the cause.
Tell me a little bit about that cause and you know, what do you bring to that?
Well, I had the honor of serving in the Congress and authoring the law that requires that the brain be treated like every other organ of the body by insurance companies. And essentially the law says that no matter where you are in your care, you need to get the same quality and access and scope of services for a brain illness like you would get if it were any other illness of the body. So we all know that brain illnesses aren't treated the same, mental illnesses aren't treated the same as cancer and cardiovascular disease and diabetes. But the real fight here is to make sure that they are treated the same and even treated more effectively, because without good mental health, the rest of your physical health is really affected. And that's why we so much support what Mission Hospital has done, integrating mental health and addiction services into the overall healthcare system. That's really the gold standard for our country going forward, is having mental health everywhere in the healthcare system, and not having it be a separate and unequal system of care, but rather bringing it in the main healthcare system so no one feels a sense of stigma because it's treated like it's something to be ashamed of, but rather treated as the medical illness that it is.
So when you talk a lot about the stigma, I mean, people just don't want to talk about it, or they're just not accepting of it. What do you think is causing that?
Well, I am someone in long-term recovery, means I haven't used drugs or alcohol since February 22nd, 2011. But I've been grappling with the disease of addiction and depression my whole life. It has been compounded by the fact that I've always felt ashamed about feeling that I had one of these illnesses, and it also was compounded by the fact that I didn't want to talk about it. So this is the heart of the challenge. We have to make people understand that it's important to get treatment, and it's better if it's early in the course of the illness rather than it's late. Just like any other illness, get that stage 1 screening. You can avoid the stage 4 down the line. But unfortunately with mental illness and addiction, we still as a nation treat it as an acute and as an emergency situation after we've known there's been a problem for a long time, but no one's talked about it. And we need to reverse that trend and start early, just like we would with cancer or any other physical illness. Screen, and find out who's high risk and make sure they have the right services to prevent them from having the problems down the line.